Some of the key findings from the survey are: one, access delays and systemic inefficiencies. Public hospitals such as Kenyatta National Hospital and Kenyatta University Referral Hospital reported frequent systemic delays that left patients waiting for hours to access critical services, including diagnostic, imaging, and specialized procedures. In many facilities, technical failures and system hang were common, exacerbating patient distress. Number two, limited SHA coverage in private facilities. Private hospitals, including Nairobi Hospital and Rural Family Hospital, Specialty Hospital, restricted SHIF coverage to civil servants in specific job groups, leaving most NCD patients ineligible. Cancer patients, transplant recipients, and other high-risk groups are especially affected by these limitations in coverage, leading to an increased reliance on out-of-pocket payments. These conditions were previously well covered at NHIF. Three, inconsistent access to specialized care. Mission hospitals like Tenwek Hospital reported no SHIF coverage, creating significant gaps in access to specialized care for rural patients. Public hospitals such as Mama Lucy Kibaki and Bagathi Hospital are unable to perform advanced procedures like cardiac surgeries for SHA patients, severely limiting life-saving interventions for NCD patients. General challenges across facilities. Outpatient and drug refill services. Patients now face out-of-pocket expenses for primary healthcare services previously covered under NHIF, adding financial strain and limiting basic healthcare access for NCD patients. Unresolved NHIF debts and lack of clarity on SHA benefits. Providers noted the accumulation of unpaid NHIF bills and unclear benefit structure under SHA. These uncertainties make healthcare providers reluctant to offer services, fearing reimbursement delays or exclusions. There is no overseas treatment coverage. The Social Health Authority has suspended coverage for overseas treatments, leaving many patients without options for specialized care not available within the country. Limited public awareness. Many patients lack information about Social Health Authority benefits, premium structures, and eligibility requirements, leaving them unprepared for changes under Social Health Authority. Conclusion and recommendations. Survey findings indicate that the Social Health Authority rollout has struggled to meet the healthcare needs of persons with non-communicable diseases in Kenya, prompting urgent calls for improvement. The Caucus of Patient-Led Organizations of NCDs urges the Ministry of Health and the SHA management to take immediate action on the following recommendations. 1. Resume Social Health Insurance Fund coverage for overseas treatment to support patients requiring specialized care unavailable locally. 2. Clarify and publicize Social Health Authority benefit structures to ensure transparency and restore patient trust in the system. 3. Address system failures promptly to streamline registration, pre-authorization, and payment processes and reduce patient waiting times. 4. Settle outstanding NHIF debts to allow service providers to confidently accept Social Health Authority patients and reduce financial burden on patients. 5. Launch public awareness campaigns to increase understanding of the Social Health Authority benefits, registration requirements, and financial options. 6. Engage patient organizations and civil society in dialogue to ensure patient-centered solutions throughout SHA implementation. Now, before I hand over to Evans to read the section from the caucus chair, I would like to add that some of the challenges we have highlighted here are really systemic challenges. They are not related per se to Social Health Authority. So I would like to add here that the entire system needs to be working. There are systemic challenges in the health facilities, and this means that somebody who has now joined Social Health Authority and is getting a cover from Social Health Insurance Fund will end up in a facility that does not have some of the services that are being covered under SHIF. Now, that is not a problem of SHIF or SHA. It is a problem of the hospital itself. This is a challenge we have seen particularly in government and county hospitals, whereby the services that are covered by Social Health Authority are not available in that facility, and they are not covered in some of the private facilities. So the patient is still forced to go back to the pocket and to pay out of pocket. We'd also like to urge our members that should you find yourself in a facility that is not covering you fully for Social Health Insurance Fund, feel free to find another facility, either in a public or private sector, that is offering those services, and move there and get those services. So don't get stuck in one facility, and if it doesn't have the services you need, you feel like you're stuck there, go to one that is offering the services, because we know there are some facilities which are offering some of the SHA benefits. Go there and access those services in the facilities that are offering them. Finally, we have very elaborate Social Health Authority benefit packages for different conditions and different non-communicable diseases like renal, cancer, diabetes, mental health, and others. But you will find that some of those benefits are not yet available. Yet the communication we have that is that SHA is running, go and get the services. And I'll give an example of the post-transplant benefit. The SHA, the renal benefit package under Social Health Authority now includes post-transplant medication. My friends and family and relatives who have been supporting me with post-transplant medication are very excited that now the government has finally heard our cry and is covering these drugs. But they are not available. That benefit is not yet ready. Yes, it has been published and publicized to be available, and so this creates now the kind of disillusionment that you are finding with Social Health Authority among patients and other members of public, because some of the things that have been promised, some of the promises that are being promised are not yet available. So we need very clear communication from the Social Health Authority management and the Ministry of Health leadership about what is available, what is not available, what is possible now, what is not possible now. If it is not possible now, when will it be possible? So that as we go to these facilities, we know what to expect. It is very frustrating when a benefit is published only for me to go to a facility and to be told that it is not there, and the person who is telling me it's not there does not understand why it's not there. So we need clarity on these matters so that expectations are met and people will have more confidence in enlisting and enrolling into the Social Health Authority. Thank you.
Thank you, Bwana Vice Chair. I will now read as the Chair of the Caucus of the Patient-Led Organizations of NCDs in Kenya. Basically, ours is to echo what the Chair, the Vice Chair has read, in the sense that the survey findings reveal critical gaps in SHA's ability to serve Kenyan patients effectively and efficiently, especially those facing chronic and complex conditions like cancer, diabetes, and cardiovascular diseases. The Social Health Authority rollout must prioritize transparency, access to specialized care, and patient inclusion to fulfill the promise of universal health coverage as stated by the President. We therefore urge the Ministry of Health, Social Health Authority leadership to engage with patient voices and take swift corrective actions to address these issues. The caucus of patient-led organizations of NCDs remain committed to advocating for the health needs of all Kenyans. Through collaboration and informed action, we can work towards an equitable healthcare system that guarantees timely, quality care for every patient in Kenya. Just as to elaborate is the fact that, yes, we've witnessed for the last 1 month systemic challenges in the rollout of SHA medical cover. This has been met with so many challenges and desperation from the patients, in the sense that what you used to enjoy as a benefit from NHIF previously at a particular hospital, today it is no longer available, yet it is published in the SHA Act. And therefore we ask and we urge the Ministry of Health, the CS, the PS, and everyone who is concerned to heed to the plight of the patients, in the sense that they will make it public to all people, to all citizens of Kenya, that this is what we are offering. This is not available at this particular level of hospital. This is available here, and make it available whenever they say that it should be available. We know the outcry has met some challenges also, in the sense that what is being reported to the leadership is not actually what is going on in the field. And that's why, as the caucus, we did this survey. We realized so many challenges, and we urged the Ministry of Health to come in and help to avert the crisis which is looming in terms of the chronic conditions that people suffer from. Thank you so much.
Probably I would just like to add that I've just come from a meeting with the CS for Health this morning. Dr. Deborah Barasa, the DG for Health, Dr. Patrick Amoth, and SHA management. And we've had a very constructive engagement, and we have relayed some of the challenges experienced by our members, particularly the renal patients. And we have expressed our fears and frustrations, and this will be addressed. And the CS has also requested us to be good ambassadors for the Social Health Authority and Social Health Insurance Fund, particularly renal patients being some of the biggest beneficiaries of this fund, which we agree. But I would like to say that we shall not be very convincing ambassadors if we are convincing you with tears in our eyes. So we would like to ask the MOH and Social Health Authority to wipe the tears in our eyes by resolving some of the small teething problems that we are still going through, and we will be able to become convincing ambassadors of people to join and enroll with the Social Health Authority. And it is important that we all enroll because, like I have said, we are some of the beneficiaries. A dialysis patient receives 2 sessions of dialysis every week, currently being funded at 10,650. A patient who pays 500 shillings a month, that's 6,000 per year, is not even enough to pay for 1 session of dialysis. So we, the renal patients fraternity, know that we rely upon the rest of the members of societies who subscribe and pay their social health insurance fund faithfully to be able to access the services that we do. So we would like to encourage everyone to enlist and enroll with the Social Health Insurance Fund, Social Health Authority, and let us struggle, let us complain, let us push and shove from inside. And we are confident that things are going to improve, and we hope to continue having these engagements and dialogues and feedback with the ministry, with the Social Health Authority, so that eventually we can have a robust social health insurance fund that is beneficial to all of us. Thank you.
There is something that we mentioned about overseas treatment. Right now, no patient is funded by SHIF to go for specialized treatment out of the country. So it's one of key issues that we urge the ministry also to come in and ensure restoration of overseas treatment package for patients, especially for heart patients, for cancer patients, for kidney transplant patients, all these services that are not available in the country. Right now, we are going for these treatments maybe in India, Israel, US, UK, but right now that has been suspended. We urge the ministry, we urge SHA leadership to restore that benefit, especially for patients not to suffer. Then again, hospitals, especially those hospitals maybe that take care of our patients overseas, they still are not paid by SHIF or NHIF, maybe to say, for the bills incurred by the patients who sought services out there, maybe for the last 2 years. So we urge also the Ministry of Health, as they are doing payment of accrual bills locally. They also pay international hospitals. These are very fundamental to the well-being of our citizens in the country. Thank you.
I did emphasize that non-communicable diseases are lifelong conditions and they do affect your biological system. So any interruption in treatment and care, as we have seen since SHA was rolled out, is likely to have a deleterious effect on the patients and the individuals living with different non-communicable diseases. As one cancer survivor said, cancer is not waiting for us to sort out SHIF. Cancer is progressing. If they're not able to access treatment and care, it is going to have severe impact, one, on the quality of life, and possibly lead to premature death. So this is a matter of life and death. So seriously, we need to get this thing up and running. We need to have services available to our citizens. People have paid, some people even paid upfront for NHIF, and they're not able to access the treatment and care that they need. So this is something which is urgent, and we urge the government and SHA, Ministry of Health, to please sort out these teething problems. These teething problems should have been sorted out even before the system was rolled out. Thank you.
So we welcome questions from you, and before that, I'll let you know that we have copies, a few copies of the presser, which we shall be sharing with you after this.